Brijinder S Rana from Rana Hospital. I'm an eye surgeon. So I will be taking up topic today, that is how to check your vision at home. So these days, due to COVID outbreak, so people have to stay indoors, but there should be some way to check your vision as well at home. So you need not visit ophthalmologist for a small problem, and if the problem is big, then you can probably go to an eye surgeon. So first of all, how do you check your vision at home? So at home, first of all, you need to focus when you're seeing a TV. First, close your one eye, then close your other eye. If the vision of both eyes is same, then probably you don't have any problem. But if you have a difference of vision in two eyes, then you have a problem. Second is the color vision. First, focus to any color, any primary color, red, blue, any primary color. You check towards, you have to see towards that color with one eye closed and then other eye closed. You have to see if the intensity of color is same in both eyes. If the intensity of color is same, you don't have any problem. If the difference is there in the intensity of the colors perceived by your eye, then you probably have an issue. Third is you need to draw lines, straight lines on a piece of paper. I will show you a piece of paper like this. You have to draw straight lines and cross lines. And then again, you need to focus with one eye and the other eye. So you need to see towards the center of this paper, and then you see if the lines are straight or not. If the lines are not straight, then you have a problem in your macula. You need to go to an ophthalmologist. But if both eyes perceive these as straight lines, then you don't have any problem. If you are a diabetic or an hypertensive, you need to be very careful. Vision is very important. You have to daily monitor the vision. If there is a minor variation in the vision of both eyes, you have to check your blood sugar levels with the glucometer. You should have a glucometer at home. You check your glucose levels. If they are fluctuating and the eye vision is fluctuating, minor fluctuation is there, no problem. You have to just control your sugar. But if the fluctuation is more, if there's a decrease in vision of either eye, then you need to go to an ophthalmologist. Last but not the least, the patients of glaucoma or brain disease, the peripheral vision is very important. How do you check peripheral vision? You have to just again close your one eye, then look towards any object in the center, and then you perceive whether you can see the peripheral area of your vision is there or not. If the peripheral vision is stunted, you are just able to see front objects, but you cannot see the peripheral objects, then your peripheral vision is gone. So then you need to go to an ophthalmologist to consult him. So peripheral vision is very important in brain diseases as well, because in brain diseases also this peripheral vision goes first. You can see the center properly, no problem, but when you see the peripheral vision, there is a problem. So peripheral vision is very important in case of glaucoma and neurological diseases like brain disease. So these are all tests you can do at home. If these are normal, you need not worry about it and stay at home.